There's a question that has sparked curiosity and debate for generations. Is it better to have a penis with or without a foreskin? Whether it's about health, hygiene, sexual pleasure, or even culture, this topic remains at the center of many men's conversations and their private worries. From myths passed down at family tables to conflicting advice on the internet, it's easy to get confused about what really matters for men's health and well-being. I'm Dr. Isabel Lopez, a urologist with over 25 years of experience. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. Today, we'll go far beyond the headlines. We'll dive deep into the facts, explore what science says, and clear up the confusion about the presence or absence of the foreskin. As you watch, you'll discover practical insights that could change the way you think about your own body or support someone you care about. Some say circumcision is essential for hygiene and disease prevention. Others insist the natural foreskin is crucial for sexual pleasure and sensitivity. Which one is right? The truth lies in understanding anatomy, global traditions, and the latest medical evidence, something most people never hear in detail. Throughout this video, you'll see how each aspect connects, sometimes in surprising ways. As we move from the basics to more advanced topics, stay alert for insights that might challenge what you thought you knew about penile health. If this topic has ever crossed your mind, you're in the right place. Follow the channel to make sure you don't miss any of the valuable content we have prepared for you. The foreskin, or prepuce, is a unique fold of skin that covers the head of the penis. Often misunderstood, its structure is more sophisticated than it appears. It's made up of two layers, an outer skin layer and an inner mucous membrane, each serving specific biological purposes. This double-layered design helps protect the sensitive glands from friction, dryness, and potential injury. Beyond simple protection, the foreskin is rich in specialized nerve endings. These nerves are part of what makes the area so sensitive to touch and temperature. The foreskin also produces natural lubricants that help maintain moisture, which can be important for sexual comfort and pleasure. When retracted, the foreskin exposes the glands and allows for direct contact, which some argue increases sensation during intimacy. Scientists believe the foreskin played an evolutionary role in protecting the glands during infancy and early childhood. In environments where clothing or hygiene were limited, this extra layer reduced the risk of irritation and minor injuries. Even today, the foreskin's ability to shield the glands remains relevant, especially in younger children and in specific climates or conditions. Yet, with these functions come certain responsibilities. Proper care and regular hygiene are necessary to keep the foreskin and the entire genital area healthy. Neglecting this simple routine can open the door to discomfort or infections, a point that's often misunderstood or underestimated by many men. It's also important to recognize that not every foreskin is the same. Variations in thickness, elasticity, and sensitivity exist, influenced by genetics and health factors. These subtle differences can affect comfort, sexual experience, and even vulnerability to certain conditions. While the anatomy and function of the foreskin are fascinating, understanding how these details impact health on a global scale is the next piece of the puzzle. What does the world really look like when it comes to foreskin and circumcision practices? Around the world, the presence or absence of the foreskin reflects deep cultural, religious, and historical influences. In some countries, circumcision is nearly universal, often performed as a traditional rite of passage, a religious mandate, or even a social expectation. In others, the natural foreskin is maintained, seen as an essential part of male anatomy and personal identity. These contrasting practices have shaped the conversation about penile health in ways that go far beyond science. For example, in the United States and much of the Middle East, circumcision rates remain high, driven by religious beliefs, cultural customs, and perceived health benefits. In Jewish and Muslim communities, circumcision is not only a tradition but also a deeply meaningful religious ceremony. Meanwhile, in many European and South American countries, the majority of men retain their foreskin, with circumcision being much less common and often only performed for clear medical reasons. Historical trends have also played a major role. In the late 19th and early 20th centuries, circumcision gained popularity in certain Western countries as a preventive health measure. The idea was that removing the foreskin could reduce disease risk and improve hygiene. However, these claims have been continually re-evaluated as medical evidence has evolved, leading to shifting attitudes and practices over the decades. Public health campaigns and government policies have further influenced circumcision rates. In some African nations, circumcision is promoted as part of broader strategies to reduce the spread of sexually transmitted infections, particularly HIV. This approach is based on scientific studies showing reduced transmission risk among circumcised men, although the practice remains voluntary and context-dependent. Personal choice and parental decisions also play a significant role, often influenced by family traditions, community norms, or access to medical information. The decision is rarely simple and is shaped by a web of values, beliefs, and experiences passed down through generations. But while cultural perspectives set the stage, what does the medical community say about the actual health benefits of circumcision? Next, we'll examine what scientific research has uncovered and why the topic remains so controversial. Modern medicine has taken a close look at circumcision and its potential benefits for men's health. Numerous studies suggest that circumcised men may face a lower risk of certain infections and diseases. For instance, research shows a reduced likelihood of urinary tract infections in infancy, a benefit that can be significant for some boys. The removal of the foreskin is also linked to a decreased risk of developing penile cancer, though this type of cancer is rare overall. One of the most widely discussed advantages is the lowered risk of acquiring sexually transmitted infections, STIs, including HIV. Large-scale studies in parts of Africa have demonstrated that circumcised men are less likely to contract HIV from heterosexual contact. This finding has led some health organizations to recommend circumcision as part of comprehensive HIV prevention programs, especially in high-risk populations. Circumcision may also help prevent conditions like phimosis, a tightening of the foreskin that can cause pain and make hygiene difficult. By removing the foreskin, these potential complications are essentially eliminated, simplifying care for some individuals. Doctors sometimes recommend circumcision in childhood if these issues arise early. Some experts argue that circumcision can make it easier to maintain cleanliness, reducing the accumulation of smegma, a natural substance that can sometimes cause odor or irritation if not properly managed. For parents and healthcare professionals, these potential benefits can make circumcision seem like a proactive step for long-term health. Despite the medical advantages, circumcision is not a universal solution. The procedure's benefits must be weighed against potential drawbacks, individual health status, and cultural values. And while science offers insights, it doesn't always provide clear-cut answers. Before making a decision, it's crucial to understand the risks and potential downsides of circumcision. In the next segment, we'll explore the complications, pain, and other concerns that can arise from the procedure. And remember, join the Members Club and leave a super like to support more valuable content like this. Circumcision, like any surgical procedure, carries its share of risks and potential drawbacks. While it is generally considered safe when performed by experienced medical professionals, complications can and do occur. These may range from mild bleeding or infection to more serious issues such as excessive tissue removal, poor wound healing, or scarring. Even minor complications can cause anxiety for patients and their families, highlighting the importance of careful decision-making. Pain management is a major consideration, especially for infants and young children who may not be able to express discomfort. Although local anesthesia is commonly used, some degree of pain or tenderness after the procedure is almost inevitable. For adults, circumcision typically involves a longer recovery period, with more pronounced discomfort and potential for work or lifestyle interruptions. Another frequently debated topic is the possible reduction in sensitivity following circumcision. While scientific opinions differ, some studies suggest that removing the foreskin may slightly diminish tactile sensation during sexual activity. Others argue the difference is minimal, but the concern persists, especially among those who value every aspect of sexual experience. Long-term psychological effects are rarely discussed, yet some individuals report feelings of loss, regret, or altered body image after circumcision, particularly if performed later in life. These emotional factors can be just as important as physical outcomes, especially for those who feel the procedure was unnecessary or culturally imposed. It's also essential to acknowledge that circumcision is not always medically required. Many boys and men live healthy lives with an intact foreskin, provided they practice good hygiene and monitor for potential problems. Overemphasis on routine circumcision can sometimes overshadow the value of individual choice and medical guidance. Given these risks and debates, it's no wonder the subject remains controversial. Next, we'll dive into the role of hygiene and sexual health, areas where the presence or absence of the foreskin makes a real difference in day-to-day life. When it comes to hygiene, the presence of the foreskin can require extra attention. The area beneath the foreskin, called the preputial space, can trap sweat, dead skin cells, and natural oils, forming a substance known as smegma. If not cleaned regularly, this buildup can lead to irritation, unpleasant odors, or infections. Men with an intact foreskin must develop simple daily habits, gentle retraction, rinsing with water, and drying thoroughly. For those who learn these practices early, foreskin hygiene is no more challenging than any other routine. Sexual health is another area where differences emerge. Some men report greater sensitivity and pleasure with an intact foreskin, thanks to the concentration of nerve endings and natural lubrication. Others notice little difference or even prefer the direct sensation after circumcision. The reality is that individual experiences vary widely, influenced by anatomy, health, and personal expectations. Research has explored whether circumcision affects sexual performance, satisfaction, or function. Most scientific reviews find that men, both circumcised and uncircumcised, are capable of healthy, satisfying sexual lives. Still, some studies suggest small variations in sensitivity are the types of stimulation preferred, making it a highly personal matter. Communication between partners is crucial in navigating any changes or concerns about sexual health. Open conversations can ease anxiety, promote comfort, and ensure both partners' needs are met. Urologists often emphasize the importance of understanding and respecting each other's perspectives, especially when cultural or personal backgrounds differ. Maintaining sexual health also means being alert to signs of infection, discomfort, or persistent changes. These symptoms shouldn't be ignored, regardless of foreskin status. Early consultation with a healthcare professional is always the wisest course of action for peace of mind and optimal well-being. While hygiene and sexual health are ongoing priorities, some men face medical challenges directly related to the foreskin. What are these common conditions, and when do they require intervention? That's the focus of our next discussion. Certain medical conditions are unique to men with an intact foreskin, and understanding them is key to maintaining lifelong penile health. One of the most common is phimosis, where the foreskin cannot be fully retracted over the glands. This condition is quite normal in young boys but can cause discomfort, hygiene challenges, or even pain if it persists into adulthood. In severe cases, phimosis can interfere with urination or sexual activity, making medical evaluation essential. Another notable issue is paraphimosis, a situation where the foreskin, once retracted, becomes stuck behind the glands and cannot be returned to its normal position. This can lead to swelling, pain, and, if not treated promptly, even restricted blood flow to the head of the penis. Paraphimosis is a medical emergency and requires immediate attention to prevent serious complications. Balanitis is an inflammation of the glands, often related to poor hygiene, infections, or underlying skin conditions. Symptoms may include redness, swelling, itching, or a burning sensation. In some cases, both the foreskin and the glands are affected, a condition called balanoposthis. Good hygiene, topical medications, or antibiotics can usually resolve these issues, but recurrent episodes may signal a need for further investigation. These conditions highlight the importance of being attentive to changes in genital health. Most problems can be managed with simple treatments, but early diagnosis is crucial for avoiding more serious outcomes. Delaying medical care can result in unnecessary pain, scarring, or more invasive interventions. In rare situations, chronic issues with the foreskin may lead healthcare providers to recommend circumcision as a therapeutic measure. This decision is always individualized and based on a careful evaluation of risks and benefits. As men age, the health and care of the foreskin can evolve. How do the needs and risks change over time, especially for older adults? That's exactly what we'll explore in the next segment. As men age, the foreskin can undergo subtle but important changes that may impact overall health and comfort. Natural processes like decreased skin elasticity, hormonal shifts, and slower healing can make the foreskin more susceptible to irritation or minor injuries. Older adults may notice their foreskin feels tighter or less flexible, sometimes leading to discomfort during hygiene or intimacy. These changes are common and not necessarily signs of disease, but they do require a bit more care and attention. The risk of developing certain conditions, such as phimosis or balanitis, may also increase with age. Reduced mobility or dexterity can make daily hygiene routines more challenging, leading to a higher chance of infections or inflammation. For men who have never had issues before, new symptoms should never be ignored. Prompt consultation with a healthcare provider can prevent minor problems from escalating. Adult circumcision becomes a consideration for some men later in life, especially if recurrent infections, discomfort, or medical complications arise. The procedure is generally safe but tends to involve a longer recovery and more post-operative care than in infancy or childhood. Factors like age, existing health conditions, and personal preferences must be carefully weighed before making a decision. Older men who choose to keep their foreskin can benefit from small adjustments to their hygiene routines. Using gentle cleansers, ensuring thorough drying, and monitoring for changes in color, texture, or sensation are simple steps that promote long-term penile health. Family members and caregivers can play an important supportive role, especially for those with limited mobility. Maintaining sexual health remains relevant well into later years. Open communication with partners and healthcare providers is key to addressing any concerns and adapting to the body's changes. Sensitive topics like dryness or discomfort deserve attention and can often be managed with simple interventions. With age come new questions about the best way to care for the foreskin or whether to consider circumcision. For those seeking alternatives or hoping to avoid surgery, what options exist to preserve health and comfort? The next segment will reveal practical solutions and preventive strategies you might not expect. Not every foreskin issue requires surgery. In fact, many men can avoid circumcision altogether by adopting non-surgical approaches and preventive care. Topical corticosteroid creams are commonly prescribed for conditions like mild phimosis, helping to increase skin flexibility and reduce inflammation. When used under medical supervision, these treatments can resolve tightness in many cases, allowing men to retain their foreskin and avoid more invasive procedures. Gentle stretching exercises, guided by a healthcare professional, may also improve foreskin elasticity over time. These exercises should be performed carefully and gradually to prevent injury. Consistency is key, and results may take weeks or even months, but many men find success with these simple routines. For preventing infections and maintaining overall penile health, daily hygiene remains the cornerstone. Using warm water to clean under the foreskin, avoiding harsh soaps, and ensuring the area is completely dry can significantly lower the risk of irritation or infection. Wearing loose, breathable underwear and choosing natural fabrics may further promote comfort and airflow. When infections do occur, prompt treatment with topical or oral medications can often resolve symptoms quickly. Antifungal creams, antibiotics, or other targeted therapies are effective in most cases, especially when started early. Open communication with a healthcare provider helps ensure the right diagnosis and personalized care plan. Education and awareness play a powerful role in preventive health. Understanding normal anatomy, recognizing early warning signs, and feeling empowered to seek medical advice are all vital steps for men of any age. By staying proactive, most foreskin-related problems can be managed without surgery. For those still weighing their options, it's helpful to look back at everything we've covered. But how does someone actually make the best choice for their own health, considering all the facts and advice? In the final segment, we'll tie it all together. And don't forget, join the Members Club, drop a super like, follow the channel, and leave a comment to support our work. Not every foreskin issue requires surgery. In fact, many men can avoid circumcision altogether by adopting non-surgical approaches and preventive care. Topical corticosteroid creams are commonly prescribed for conditions like mild phimosis, helping to increase skin flexibility and reduce inflammation. When used under medical supervision, these treatments can resolve tightness in many cases, allowing men to retain their foreskin and avoid more invasive procedures. Gentle stretching exercises, guided by a healthcare professional, may also improve foreskin elasticity over time. These exercises should be performed carefully and gradually to prevent injury. Consistency is key, and results may take weeks or even months, but many men find success with these simple routines. For preventing infections and maintaining overall penile health, daily hygiene remains the cornerstone. Using warm water to clean under the foreskin, avoiding harsh soaps, and ensuring the area is completely dry can significantly lower the risk of irritation or infection. Wearing loose, breathable underwear and choosing natural fabrics may further promote comfort and airflow. When infections do occur, prompt treatment with topical or oral medications can often resolve symptoms quickly. Antifungal creams, antibiotics, or other targeted therapies are effective in most cases, especially when started early. Open communication with a healthcare provider helps ensure the right diagnosis and personalized care plan. Education and awareness play a powerful role in preventive health. Understanding normal anatomy, recognizing early warning signs, and feeling empowered to seek medical advice are all vital steps for men of any age. By staying proactive, most foreskin-related problems can be managed without surgery. For those still weighing their options, it's helpful to look back at everything we've covered. But how does someone actually make the best choice for their own health, considering all the facts and advice? In the final segment, we'll tie it all together. And don't forget, join the Members Club, drop a super like, follow the channel, and leave a comment to support our work.